Another interesting point, and I'd like to bring in Brad Blakeman here on this one. He talked about the positives here. Keeps pre-existing conditions covered, expands health savings accounts, devotes substantial funds to the opioid crisis. So Richard and then Brad. Let me start with Richard. What about those positives? Isn't that enough to bring Democrats to the table for some bipartisanship discussion?
I mean, that sounded good, but it was light on details. He doesn't really tell you in this speech, nor have Republicans showed you how they plan on covering those with pre-existing conditions, number one. And number two, it does expand health savings accounts. But, Liz, if you don't have any money to put in your health savings account, then expanding it really does you no good now, does it? And I think when you're talking the Americans that are going to be hurt from a repeal of Obamacare are those that finally got access to health care because of Obama, because of the Affordable Care Act.
Well, let's be real clear.
So
Americans always had access to health care. What they did not have access, no, it is true. My brother works in a hospital. No one turns away people from hospitals. What they don't have access to is insurance, and that's what Obamacare is about. Now, the real question is this: are we going to penalize? And I think this is where the president makes a mistake. He doesn't bring this up. Are we going to penalize 99% of the country for a small amount of people who get health care coverage in other ways? And I'm telling you, you're basically on the backs of working class and middle class Americans. They are the ones that are paying for the insurance subsidies for people that don't have it. I mean, that's basically what you have here. It doesn't affect anybody else.
Wait a minute. Let's be very clear here. So let's talk about, for example, a young girl who has asthma, who before the Affordable Care Act could not get health care insurance because she had what was called a pre-existing condition.
Weren't covered by any insurance?
People were literally being denied health care coverage. If you remember 8 years ago,
they were being denied health care coverage, but not health care.
Not care.
Yeah, but if you go to if you don't have health care insurance in our current system, right?
Go to Bellevue. They take care of your best doctors.
Let me make my point.
See, Charlie, when you go to Bellevue, you and I end up paying for those people who support the store of hospitals.
Liz, the question is this. The question is this. Was the old crummy way any worse or better than the new crummy way? And I'm telling you, the old crummy way might have been better.
Okay.
No, that's just not
true.
Because
you're screwing over working class Americans.
Wait a minute.
Bill Clinton said it the best.
True.
Bill Clinton said it the best. It was absurd that working class Americans had to pay for those increased premiums to finance poor people. That's what basically said.
Hold on, guys. Let me let Brad get in here. Brad.
Look, Americans under Obamacare, and Charlie's right, has been the burden of Obamacare. Not only do they have to scrape and to pay for their own coverage, but now they're on the hook for other people who are irresponsible. So the system doesn't work. It costs too much and it cares less. It's got to go. And this was a Democratic plan all along. They knew Obamacare was destined for failure, and as Chuck Schumer said today, it was all about a single-payer system.
Right.
This was the way to get there. And guess what? Donald Trump came along, and Republicans, and they said, no, we're going to fix it so it's more equitable and fair for everyone.
But they're not fixing it, Brad. And Rand Paul simply said, why would I vote no for a procedural move to the next phase if I don't know what's going to be offered in the next phase?
Look at the history of entitlements. It's almost impossible to take away entitlements. What I think with their strategic error here was that they should have started with tax cuts, got the economy going, and chipped away at this. Because taking away entitlements is the third rail. Man, we've been talking about Social Security reform forever. Medicaid reform. By the way, in this bill, there is a serious attempt at Medicaid reform where able-bodied people should not be going on Medicaid. They should be working. One way
to get some benefits of Medicaid.
One way to get people health insurance is to give them a job.
You have a job
and also make it affordable.
Wait a minute. That's a distorted view of reality, because we're the people who benefit from Medicaid expansion. Take somebody in Ohio. They're working 2 jobs. They're working at Walmart and working at McDonald's, and they still can't afford health care coverage, which is why we expanded Medicaid the way that we did. The other point I want to point out here, remember, the bill is called the protection.
Usually people that have jobs have insurance.
Let me finish that is not true.
It is true.
Let me finish my point. It's called a patient protection Protection and Affordable Care Act. The patient protection portion, Republicans are trying to gut. And what that says is that if you pass out at your 50th wedding anniversary from a heart attack, you're not on hook to pay for the ambulance that takes you to the hospital. Prior to the Affordable Care Act, that is true. Read the bill.
No, it isn't true.
Read the bill.
And by the way, in the Republican bill, it creates a high-risk
What Republican bill? Is there a Republican
bill? To pay for Medicaid expansion, and we're returning the power back to the states where it belongs.
See, what liberals don't like is that the states are now going to have to take care of it.
Right.
They don't trust Florida to implement their gold-plated Obamacare mandates. That's what they don't trust. They don't trust southern states to implement what liberals in New York want.
Because the
I would love
president
to continue this, but we got 3 minutes left in the show, and we've got a NASDAQ that's exploding. A lively discussion. We really appreciate it, guys. Thank you very much.